both of your work is super interesting and super complex, and I'm going to ask if you can sum it up each in a few sentences.
I think I have this fundamental belief that if you really want to fix something, you have to deeply understand it. And so my work has been sort of, I think 10 years ago, I decided we should try to understand how the brain becomes wired up in utero. And so I took pregnant women and put them in MRI machines and tried to ask questions like, can we tell that a fetus will go on to be born to be a child that has autism? Or is this a baby that will later be born preterm? And then also, is this a woman? So we also scan the mom's brain who might have mental health challenges in the postpartum. So a lot of my work is really just trying to understand how it's built, and I have that fun job.
I'm a computer scientist and I run a computational group, and we focus on developing algorithms for women and children's health throughout the lifespan of women. So from actually adolescent is probably the right way to start, but we're starting in fertility, pregnancy, lactation, and long-term health. And we're building huge data sets in collaboration with across the institution and other institutions. And we're designing algorithms that will help us answer questions related to pregnancy, diagnosing pregnancy disorders early on with very unique modalities like scanning the retina, which I hope we'll talk about more in a few minutes. But then also thinking how we can utilize and leverage this data for long-term women's health, because women that are diagnosed with pregnancy disorders, specifically hypertensive pregnancy disorders in pregnancy will have lifelong health risks, and we don't understand why. And if we prevent these pregnancy disorders, do we lower the risk of their long-term risk of vascular dementia, of heart disease, of cardiovascular disease, of hypertension? So again, like Allison beautifully said, we're looking at the entire continuum of women. And what I really want to do is with this collaborative, is collect all this data from all these specialties and create algorithms that will serve the clinicians. So that's what we do.
Juna, I'm going to put you on the spot for my second question for
Yes,
both of you,
please.
since it leads right into, how is AI and how is imaging helping you learn what you're learning?
So let's be more specific. What we're doing here on the 4th floor is that we're scanning women during their pregnancy, 1st, 2nd, and 3rd trimester, but we're not scanning their placenta, which is the root cause of a lot of these. We're scanning the retina. We're using the retina as a proxy because it's useful, because it tells us a very important, it gives us a lot of information about the pregnancy, and it's easy. So right now we're doing that with a quite bulky machine, and the goal is to move to a portable device and honestly to the phone. Speaking of, we don't have time, so women can scan, that's the vision, women can scan their retina with a portable device or even with their phone, upload it to a database, and our algorithms analyze it and can flag women at risk. And that can help us move from reactive to preventative medicine, especially during pregnancy, which is an important window to cardiovascular health.
So Dr. Thomason, how are you using AI and imaging?
Yeah, I'll actually pick up on the importance of being able to get away from the bulky machines and get into things like phone technology, partly because you can get to people, but partly because health often happens outside of the times that we're able to actually bring people in and engage them. And with all of the wearable devices, we can gather so much information that sensor technology is getting better. The AI, which I guess is the question I should circle back on, together those combined can actually revolutionize the way that we understand what predicts what, because it's so much information. Like if you just think of the basics, like this is going to happen no matter what. Like this is just reading what's already happening. So the revolution in AI, the revolution in wearable sensors is actually going to give us the opportunity to collect unprecedented data that we can analyze and understand, and interesting things will arrive. And I think this is one of the things to think about is there are things that we will discover that don't make sense to us, because that's what AI is. It's actually one of the things that it is an opportunity to put things together that are so high dimensional or high order that we can't easily deconstruct them, but they can inform how we care for people, and they can lead us down paths that we wouldn't have expected to go down. like the things that are not intuitive to us that we can discover. So really, it's exciting to be at this place and just be aware of what's happening in society. And it does bring us back to unconventional relationships, because the way that we do things in medicine, the way that we do things in science, we've inherited. But the way that we go forward is going to require sort of reverse engineering. What is the new world, and what are the partnerships that need to be in place?
Dr. Shinhav, your work has highlighted a little bit about how the computational tools that you use are being applied differently, or sometimes maybe not at all, in women's health. Can you talk about that a little bit in pregnancy, lactation, and women's health?
Yeah, so women live longer than men, but they spend 25% more time in poor health for all sorts of reasons, because they don't have time, or their schedule doesn't allow them to come to a mammogram, or because they're diagnosed significantly later for many diseases like cancer, like diabetes. There was a report from McKinsey last year that showed the root causes of this phenomena. And to me, the most striking thing was that this 25% of poor health was actually spread out throughout women's life. It wasn't biased because they actually live longer. It's infertility years. So they've looked at it from kind of the economic potential. But, in this context, part of the reason is underrepresentation in data. So we don't have enough large-scale data that represents women, that can help us do the type of computational and algorithmic development that we want to do. But at the same time, we need the technology. AI and retinal imaging is an active field of research, but a lot of the data sets are of older people that go routinely to their ophthalmologist because they have vision problems. So women in their 20s, 30s, 40s are not being well represented at all. So it's therefore algorithms for what? So we are trying to change that, changing the data as well as what we can do with it, and what algorithms we can actually design to best leverage the data that we purposely collect now, that we don't just use because it's there.
Yeah, fantastic. So, Dr. Thomason, then your work, you were talking about the bulky machines, and your work isn't only about MRIs and other technologies. Can you talk just a little bit more about wearables? Because, I don't think the Oura Ring is like looking at the fetal brain. So can you talk about how we will, how you want to leverage everyday tools?
I think this is really exciting. First of all, people like wearing it. So if you really want to help people, you can't give them these uncomfortable situations and say, hey, you should do this, and get the important information to develop the algorithms. And the ring, for example, the Oura Ring, is something that we're using during pregnancy. It holds a long battery charge. It's waterproof, it's practical. You don't have to. We've also worked with Apple to get other types of behavioral information. My idea, and I've talked to Dana Gossett, our chair of obstetrics and gynecology, about this, is that we can actually predict when a baby's going to be born ultimately, or the health of a woman, or her mental health. And we've actually tried it with our data, and it actually works. So we have women wearing Oura Rings during pregnancy. You can also attach these to glucose monitors, which are a little bit more invasive. So we're really kind of dancing that line of what actually works for people. But my thinking is, even if you know that you can expand, practically, that somebody is at greater risk for something, you don't have to actually do individualized prediction. So if you think about genetics, right, we know that certain categories of people are at higher risk, so that we can do the follow-up work. If there was a way to just very simply put things into people's lives and have that data push up to a cloud and have that data analyzed in real time and have that come back as a report, which, by the way, we can do all these things. We can do all of these things. Companies are doing this now. It's really a lot of steps. You have to reverse engineer the problem. You have to get into clinical practice, which is hard, but all of these things are available. So nothing I'm saying, I'd love to say grandiose things and not have to show you scientific data. It's really exciting to get up here and say these things because I can, but these are real things. These are real doable things that we can start doing now. So I am thrilled. And also, from a lifespan standpoint, you talk about different times in life where you have information. We have to start in utero. It's the very beginning. So I am talking about women's health when I talk about fetuses.
Yeah, and that actually leads into the last question, which is to go even bigger about how this work and how the collaborative work you do here might or could change health and healthcare for women.
Do you want to go ahead?
No, go. Start in utero.
Well, the connectedness of things is something that AI will begin to also help illuminate, right? We can't see all of the things. We can't see all of the connections. But for me as a developmental neuroscientist, it does begin and it does connect across the lifespan. So I think really it's just being able to connect the dots in meaningful ways. And I was speaking to Alec earlier about what we're going to actually do. And I think it's amazing to think that if we just have a way to take in the information and actually make use of the information, which is not a small challenge, but if we can figure this out, it is a revolution. And what does it mean to figure out to save time and save money? Well, it means that we've like fast forwarded the whole scientific paradigm, the whole clinical paradigm. Time and money isn't just a thing that we say. Like, it's actually us watching health happen faster, and it's us also seeing that family have a different outcome, which is profound.
So I can say that from a computational standpoint, labs like mine don't really exist. Computational lab that focuses on women's health. And I really hope that is starting to change, that people are going to realize that, there are these collaborations, physical collaborations, that all the data is there, and there is a huge opportunity to use this data, to use the fact that women are getting treatment, are getting care. Actually, maybe that's the better way, because it's not just treatment, it's care in one place, and we can connect. And I think NYU Langone is leading this in connecting all these dots, connecting all the lifespan. And again, we're focusing on pivotal periods of how do we leverage pregnancy, but it's not just that, right? It's connecting all these specialties that you've talked about that are under the same umbrella. So the way I see it is just data, data, data. So that's really what we want to get to, is to be able to connect the trajectory in a meaningful way and build algorithms to support clinicians.
Yeah, that's also super interesting, because I think it's easy to think of math and computations and algorithms as something other. And the fact that you are both using them to connect things and also to connect health events through the lifespan is incredibly exciting. So, I think Dr. Thomason, you've mentioned that like birth is a transformational neuroscience event. And
we have such exciting data. I don't think I'm allowed to take too much more time, but both, I'll just say in a soundbite, both what we're showing is we've scanned pregnant women, their own brain during pregnancy, and there's a transition in the brain to parenthood. We just wrote a paper in Nature. You guys should read about it. The brain is actually losing gray matter, which sounds terrifying, but I think it's adaptive, because otherwise, why would it happen? Evolution doesn't work that way. And then also in the fetal brain, we can actually see transitions, and we can see that fetuses that are going to be born preterm actually have a different, and it is actually a birth transition. Birth is a neuroscience event.